Right. Good morning, Kate, all the way from Australia. Although it's not morning there, is it?
No, it's late afternoon here. We're 5 o'clock, so just
Okay.
winding down.
Oh, very nice. And my day's just beginning. So,
Yes,
now you're coming over to see us at Biomechanics Summer School in June, and we're all very much looking forward to that. Uh,
as am I. Yes.
Good. And you're going to be presenting one of the lectures and also running one of the hands-on workshops. So, can you tell us
That's
a
right.
little bit about what you're going to be covering and what you're going to be talking about?
Yeah, for sure. So in my lecture, I'm going to be talking about medial knee osteoarthritis, or OA. So we'll have a little look at the prevalence of the disease, how it affects the person, look at the pathogenesis, and in particular the biomechanics of knee OA. And I'll try and focus a fair bit more on how foot biomechanics and foot pain affect the symptoms and the structural change in the disease. In my workshop, I'm going to focus a little more on the foot. So we're going to look at assessment and treatment for osteoarthritis of the first metatarsophalangeal joint.
Okay, so obviously because I mean you've done a lot of recent research, haven't you, looking at osteoarthritis and how biomechanics affects that. So would you say that looking at the biomechanics and addressing that is an important part of managing arthritis in the knee and the foot?
Yeah, look, for sure. I think for certain people, it's definitely part of the overall management strategy. So, for example, there's guidelines out of the UK, the National Institute for Health and Care Excellence, I think it's called. So they recommend as the part of the core strategies, first of all, some education strategies for the patient, in particular on the
Right.
disease itself,
Mhm.
as well as exercise and activity, prescription if possible,
Mhm.
and also weight loss where that it's appropriate. And I think biomechanics then come in as an adjunct, and so that can be footwear, knee bracing, insoles if appropriate as well. Um, in terms of at what stage they come in, we've done a little work that actually showed in more advanced structural disease, the biomechanics can be a bit more important. So I'll be talking a little bit about that as well.
Okay, well, I think that's going to be very interesting to a lot of us because I think many of us see patients that have got all degrees of osteoarthritis of the various different stages. So I think it's very pertinent to the kind of patients that we see. Have you got three quick top tips for treatment?
Ooh. Look, yes, certainly in line with the core strategies, I think exercise, both general exercise and targeted exercise, are very important. So that's targeted in the case of the foot, it might be intrinsic muscles as well as some of the larger extrinsic muscles. Weight loss, where that's appropriate. I mean, there's some older research now showing as little as 5 kilo weight loss can reduce your risk of osteoarthritis by around about 50%. So that's quite substantial. And then certainly mechanical interventions, particularly in those that might be more inclined to benefit. So, for example, again, in first MTP osteoarthritis, we know that there's some research on foot orthoses and rocker bottom shoes that they can be effective, but in particular, the foot orthotics had higher adherence and better patient satisfaction. There's also a recent pilot study out of Leeds University, Jill Halstead, for midfoot osteoarthritis, again showing that foot orthoses can be beneficial for there. So
So
those would be my top three tips.
excellent. Okay, well, we're very much looking forward to that, and we will see you in June. Thank you for your time, Kate.
Excellent. I can't wait. Thanks very
Okay,
much.
bye bye.
Bye bye.